So I think it's time to talk about the neck and why it's so important. Within the last week, I've had multiple patients come in, probably over 5 to 10 patients come in, coming from the dentist's office because they've been sitting in a dental chair for a really long time and it bothered their neck. I've also had a couple patients come in after car accidents where we have things like whiplashes and then their neck's bothering them from things like that. I had a patient come in recently. We were seeing him last year for something, so we had some of my recent x-rays. We shot a new set of x-rays after he was just in a car accident a couple weeks ago, and the curve of his neck had almost totally reversed from last year when we took the same set of x-rays. So why is the neck important? Other than just obvious pain, can cause numbness and tingling going down the arms. One of the biggest things with the neck, if I asked you to wiggle your toes right now, I asked you to wiggle your toes, I asked you to jump, bend your knee, whatever it is, and those are all in your legs, your lower extremities. For you to do any of that, that signal needs to pass from your brain through your neck, through your spinal cord and your mid-back, all the way down to your low back, through those nerves in your low back, all the way down to your legs. That signal starts up here in your brainstem in your neck. If that signal can't get through that part of your spine, it's not going to get through the lower part. That's why I tell people all the time, even if you have an issue in your low back, a lot of times we need to check the neck because that signal, that neurological signal from your brain has to travel through that neck, that cervical spine prior to getting down to that low back. Now, all of us have a neck that should have a curve. It should have a curve like a banana. I always call it a banana. The banana's happy like this. If I take the banana and I start to stretch it that way, now it's an unhappy piece of fruit. Your neck is the exact same way. When we start to stretch our neck, or we have a whiplash, or we have something, we start to lose that curve, it puts a tremendous amount of stress on that spinal cord and the spinal nerves coming out. So the muscles are unhappy, the ligaments are unhappy, all that's unhappy, but the most important thing are the nerves that are coming out of the spine. The spinal cord that's going through the spine in that area, it's critical that we make sure that we're taking the pressure off that area. When I look at a neck and it's straight, we want to make sure that we start to take as much stress off the middle part of that neck. Typically, it's right around that 5th cervical vertebra, right where that neck starts to bend. What's happening is you have an extreme, just like that banana, right where it starts to split right there, your neck will do the exact same thing. Stress will build up in that area, and it will cause that area to start to wear and tear, and you end up having issues in your neck. You end up having issues going down your hands, your fingers, numbness, tingling, and you go to your medical doctor, and they look at an x-ray or an MRI, and they say, well, it's just arthritis, you're getting old, when really, it's been that repetitive stress over years and years and years. You had an old injury back in the day, you sat in a dentist chair for too long, whatever it is, it put a ton of stress on that 5th vertebra, that 4th vertebra. Typically, it's right in the middle of the neck. And when that stress got in there, it stayed there because we never got that thing moving correctly again. We never got that joint to move the way it was supposed to move. Your body's had that thing locked down for so long, and now the stress is spilled out in the tissues, it's spilled out in the nerves, you're having numbness and tingling going down your hands, your fingers. That is why taking care of your neck is so important. There are chiropractic techniques that will only look at the neck. They only look at actually, there's chiropractic techniques that only look at that top bone in your spine. That's how important it is to the overall just function of your body. Not even just pain and symptoms, but the overall function of your body. For your heart to beat, those signals from your brain need to make it through that top part of your spine without any impediment. Little bit of pressure on the spinal cord, a little bit of pressure on the nerves can affect the heartbeat. It can affect the vagus nerve, all these different nerves going out into your body. That's why it's crucial that we take the stress off that part of the spine. So allow your body to start to heal and function the way that God intended it to. I hope this helped. I hope you guys have a beautiful rest of your day. I look forward to talking to you guys soon. Bye-bye.